Hello, this is Dr. Brandon Pettke with Lone Star Progressive Medicine. Today we have Tiffany here. As you can tell by her shirt, she works here. So earlier, Tiffany was telling me how her knee was bothering her. She got a new pair of shoes, and then since she's been wearing the new pair of shoes, her knee started bothering her. She is very avid in her working out. I say you're much more dedicated than I am. She wakes up at like 3:45 every morning to go work out. But now what's happening is in her left knee, it's not only hurting her when she's working out, and earlier you said it felt like it was like gonna give out on you, right? Yeah. And so she's getting a sharper pain. And then right before we started filming, even just raising up from a seated position, she said the same thing there, that it was hurting her, like she's basically using her right leg and not putting the pressure on her left leg. So anyway, so we're gonna go through. I already evaluated her earlier. We checked all the major tests of the knee for ligaments and meniscus to make sure nothing's damaged there. Everything checked out clear, all the tests were negative. And so we're gonna go through and I'm gonna actually show you how I treat a knee. And so if you wanna go ahead and lay on your back, looking up at the ceiling. And so one of the first things I want to show you, Hannah, if you'll come in here. So one of the things when I was going through her knee, the knee is basically just, it's got your femur, which is your thigh bone, and your tibia down below. And they basically sit on top of each other, and you have your muscles and ligaments that support it. And so that knee just goes through a certain range of motion. It doesn't move like a shoulder, obviously. So just that range of motion forward and backwards. And so when I bring the knee out, relax your knee here. When I bring the knee out, when I push back into extension, you can come in here close because it's going to be a little bit more difficult to see. It should be solid as a rock when I push from side to side. So I'm going to push back, and when I push to the outside that way, it doesn't give at all. And she even noticed it earlier when I did it. When I push in, there's a little bit, I don't know if you can see it, it's real slight, but there's a little bit of sponginess or springiness to that. And that shouldn't happen. So what's happening is her hamstrings aren't stabilizing that knee, and she has some other dysfunction. So we're going to go ahead and adjust her knee. All right, so you're just going to relax it right here. I'm going to come behind here. We're going to first do a manual adjustment. We're going to do several different techniques. Relax here. One more. There it goes. Feel a little pop there. Look at her face. Turn over on your stomach. This one is already tender on her hamstrings, where they insert into the back of her leg, and so it will be uncomfortable when I do this. I got to put a lot of pressure. So this is going to stimulate what are called the Golgi tendon organs and the muscle spindles. We're going to come right here. Look, she's already tapping that foot. So a lot of pressure, real quick. It's going to be a real quick movement, like that. No, she didn't flinch as much as I thought she was going to. This one's going to be a little bit more tender. Bear with me. Last one. All right, turn over on your back. We're going to do one more thing. One of the other big things that often gets overlooked is the patella or the kneecap. It doesn't move like it should, and so if you don't address that movement, you're going to have knee dysfunction. So we're going to use this little tool. It just fires off and moves the joint. It's called an activator. A lot of times patients call it a clicker. But we're going to come to the patella. Hers has decent movement. Let's compare it to your ticklish. Mm-hmm. All right. So we're just going to mobilize that, and we're going to set it right here. Let's go do several of them. You okay there? Mm-hmm. I'm watching her eyes. See if she has any flinches. No flinches so far. A little bit on that one. It was a little tender. Yeah. All right. And then we got, how's that one?
A little tender.
A little tender there. Start mobilizing, getting in movement. Movement's life. Gotta get it moving if it's gonna function correctly. All right. Easy peasy. All right. Let's have you stand on up. 1, 2, 3. Come on up. All right. So the real test. Let's have you walk around the table and see how it feels. How does it feel?
It feels better. Like more just solid. Like
solid?
It's not as like it's gonna give out as much.
Okay, so let's have you lay back on your back and let's recheck it. Let's see how it feels. This may be tougher to get on film, but you go back. You're still solid there. It's still slightly, but a heck of a lot better than what it was. Can you tell the difference?
Yeah, I can even tell that it moved slightly.
Hey, let's check one other thing. We didn't do this ahead of time, but let's check the test where you were come up and go lay back down, face down. All right, so this one that I did brought it up, and earlier I pressed down and twisted like that. It had a little twinge. Does that one still get you a little bit?
No.
No, it's all gone? Mm-hmm. All right, awesome. So come on up. So anyway, so that's it. That's a treatment of the knee. A lot of the things that we do here in the clinic are non-surgical and drugless. And so if you got knee pain, we can contact our office and we'll get you evaluated and see how we can help you. No need suffering. So anyway, hope you have a wonderful day. Take care.